Hey everybody, welcome back to Jon David's Journey. I'm Justin, Jon David's dad. That is Mallory, Jon David's mom. And Jon David's right there in the chair with her. Hunter, big brother, is not here. He's back at home. Now, a lot of y'all have asked the question of, does Jon David need another surgery? The answer to that question is yes, he does. A lot of y'all have also asked the question of, when does he need that surgery? And that one, I can only tell you the same answer that we get, which is, it depends on Jon David. I can give you a rough timeline, but I can't say exactly when because we don't know yet. So, we do know that it will probably be sometime between the next 1 and 3 months. We are hoping July. However, we don't know for sure because all of that will be based on him and how he does with growing out of what has been done in this first surgery. Now, if you have gone on and watched What is Toxic Being, then you know exactly what is going on with his heart. If you have not yet, then I am going to break it down for you. So, this is a typical heart. You have your pulmonary artery here, which takes blood and sends it to the lungs to get oxygen, and then it comes back and it comes in here and it goes out of the aorta into the rest of the body. So you're getting oxygen rich going to the body, you're getting oxygen poor going to the lungs to get oxygen, and then there's this constant little cycle of oxygen rich blood going to the body, being used, coming back from the body, going to the lungs, and then coming from the lungs, going to the body. So you've got this continuous cycle. Along with this, there's this ventricle septum, which separates these two ventricles in the heart. Now, in Jon David's case, we have this, okay? So this is his aorta, which should be taking oxygen-rich blood back to the body. This is his pulmonary artery, which should be taking oxygen-poor blood to his lungs to get oxygen to bring it back for the aorta. Now, they're not in the right spot. If you remember looking at the other one, this one was actually here and that one was there. That is known as TGA, or transposition of the greater arteries. They're just not where they're supposed to be. He also does not have that ventricle septum, which is the wall that separates the two ventricles. So when blood is getting in here, it mixes between them. And part of the problem, or the largest part of the problem, is that blood keeps trying to go to the pulmonary artery. So you're having oxygen-rich blood come back and then go out and come back and go out, and the oxygen-rich blood is not going to the aorta. You're also having oxygen-poor blood just circulate through the aorta and not come over here to the pulmonary artery where it needs to be. So the reason why they put this little line here is in his first surgery, they had what are called pulmonary bands, which help restrict blood flow. The idea being you kind of dam this up and make the blood, or essentially encourage the blood to go here. So that way it kind of slows this down, gives the blood time to travel, come over and go here to go to the body. That's the idea anyways. It has worked pretty well since they tightened that in his third open heart surgery. But this right here, it's not drawn on here, but that right there is where the hypoplastic aortic arch is, meaning it's too small. They did an arch repair there, and they also did another repair on the arch in his third surgery. Now you're like, we know all this already, we've seen it. So this is the new stuff. This is what's going to happen in the next surgery. The next surgery, they're going to take this band off. They're going to switch these back to where they're supposed to go, and they're going to build this ventricle septum. They're going to rebuild it, assuming that his physiology does not change between now and when they have the surgery, because he is a small baby and things might shift a little bit. However, if it stays like this, they'll build that ventricle septum, and they'll pull the switcheroo, take the pulmonary band off, and then from then on, his heart, for all intents and purposes, will look like this, right? So, yes, they'll have to actually construct that, and they'll have to do their little switch there, but he has all the right pieces, they just weren't necessarily in the right spots. And the one piece that he did not have was that ventricle septum, but they can build that. So, that is what his second surgery is going to look like. Again, we cannot tell you when that's going to be. The best guess is July, August, but all of that depends on Jon David, which is a catch-22. We want him to grow and get big and continue gaining weight. The quicker he gets bigger and gains weight, the quicker he outgrows that pulmonary band. So those pulmonary bands that are sitting on there, they don't grow with him. They are artificial material, so their size is their size. As he grows and gets bigger and his heart and his blood vessels get bigger, he's going to outgrow that band. So as he gets bigger and that band starts restricting more, it's going to start causing him to desaturate, so get lower on his oxygen in his body. And so that is going to be kind of the trigger that is going to say when we are ready for second surgery. As long as he tolerates it and stays in the 70s, they're going to let him just keep on growing and getting bigger and stronger. Once he starts getting into the 60s, the conversation will be, okay, not when we're doing this way out in the future, it's going to be, okay, this surgery has to happen and we have to figure out exactly when. That being said, he will be monitored. We will go home with things to monitor his oxygen saturation. He will have routine follow-ups. One of the things I found out this week is that he'll have a catheterization to get more data before they even start all of this. So they'll do that first before they even start doing all the monitoring and things at home. So that way they can get a better idea of when they think that he might have that second surgery. Again, it won't be specific. It won't be like they're saying July 8th. They'll just say, okay, we have this data now and we have a general idea of how long this might be able to last. So hope that answers your questions. Again, the two that I've been getting have been, does he need a second surgery? Yes. When is that second surgery going to be? We don't honestly know, but we do know that it'll be in the general time frame of sometime towards late summer. Hope that answers your questions. If y'all have any more, please feel free to reach out and let us know, and I will do my best to answer them. Y'all have a good day and God bless. And Jon David, tell everybody bye-bye.